For years, you've been screening patients for anemia to check their iron levels. But here's the thing, testing for anemia is not testing for iron. When patients don't have enough iron, they don't make enough healthy red blood cells. But iron deficiency matters way before that even happens. And here's an unfun fact, about a third of premenopausal women are iron deficient. So iron is stored in the body as ferritin, a protein we should also be regularly measuring. The World Health Organization says that you're iron deficient if your ferritin levels are less than 15 micrograms per liter of blood. But other experts argue that that number should be closer to 30 or even 50 micrograms. Basically, the level at which your body stops craving more iron. And using those higher numbers, a recent study found that 78% of young women and girls could be considered iron deficient. Well, that's ridiculous. If that many people were tired and irritable, we'd be hearing so much about it. Or women have acclimatized to their base levels of energy and taken that as the norm. And even when we do test for ferritin levels, the way we determine what's healthy and normal is often skewed. Labs regularly base normal levels on a population where iron deficiency is already common, so the average ends up low, but that doesn't mean that it's healthy. Well, aren't you just pathologizing something women have lived with forever? Like, if a majority of people have low iron, maybe that's just fine. We don't define things like high cholesterol or hypertension using averages. They're based on health risk. Similarly, iron deficiency needs a physiological definition so that we can better diagnose and treat patients regardless of population averages. Look, I'm just saying we should probably start testing for iron more often. But if patients aren't anemic, why should we make iron testing routine? There aren't many studies that show how screening will help women's health. You're right, it is an underfunded and understudied area, and there's still more we need to learn. Well, wait, but there's a lot we do know, and there are plenty of other things that we already recommend screenings for that have less evidence than this.